Amen.
Yo, amen. Yo, opening way there. With us be brain brain no. And then you be coronavirus vaccine no what's them. Meaning some Watson sim be brain efa vaccine no ho. Na the message and says brain no nipa be 23 million. And one when ya coronavirus America in kwa. Into where we are seeing nipa 23 million. America han kwa na coronavirus. Na emu 394,000 and a free sa coronavirus a year ka ho asemi nipa 394,000 and almost a free coronavirus na coronavirus no enya ade a eye bibi foforo because coronavirus dey ade a e wo kodada but sa foforo ya o mahu ni yidie and no and the cause COVID-19 disease near Kafwatem no. Your coronavirus ahodo a be a bit me am cold, a common cold, and I say bibisa and a common cold. But for prayer you did and no cause more major disease I friend COVID-19 no. The metro mudi intra ya shorten COVID-19 no. See or no age na homa corona. It is a ocean virus, and I'm just going to share my screen, but I'll say I said a court system preferences near the I'm not going to waste time. See or no age na homa corona. If it's a coronavirus, na yes or hineche. It is a osha a round, and a osha near me to home, and noon to near friend again corona, make sure it's a crown. It is a osha or hinia no himacha. Who say Chinese woman so a round. Now osha ya na near me be home and noon to near friend corona no. Na VI no age na homa virus. And a D no age na homa disease. And no into your friend no COVID-19. Na 19 that was on it you no 2019. It's usually Arabia ba. I think you be who knows the cover your friends COVID, especially with COVID no. Seba, I see you be who know your friends as mo sha un so cafe e be influenza disease no mark e be a time as influenza disease na e day e buy. Into no into your friend COVID-19 no. See, I shall COVID-19, a kum a before any Spanish for any Native American for power more chain abroad for cry any Asia for. Now, I didn't see the yes, sir. Now, can you focus all if you saw more comorbid diseases to say via diabetes, the high blood pressure, the idea. Yes, other a year, friends say ethnicities no so almost so a diabetes, the high blood pressure, and home crowd about. And the other internet before one a year in Bibribe. Now, is what they see you queen in Bibribe. And here, when be an obia will be a when we are friend enzyme. Enzyme no a dear bad dear. And the same can would not if you would know board dear now bind to be an hour buying. Now the engineer gum. And to the engineer gumwa, na ya day, and ma a day, a good time. In the enzyme or no so a catalyst. I said you wouldn't see a goose, you know who intends to my mouth. Now the idea, oh, you know, in the catalyst, a woman be a day, a coso and pentem, away a hundred piano. Yen now be our be. Now enzyme be away a hundred piano, and it to me dear 80. It is our enzyme near around. I no extra at the crib to be a day, a papa telephone. It is said, enzyme no see if I say enzyme near I say, well, kidney, so now I dear never better home and near a no empire and carry home. And can yes, and enzyme be able to be a dope. Who's a young for whom? Why enzyme be out for you, my dear. Through our hundred piano. So there be enzymes, so almost you will pay the iodine. Your hundred piano. Now your enzyme be a friend angiotensin converting enzyme 2. And Tiana use your most shorten ACE2. May a short of what in right from ACE inhibitor. ACE inhibitors do usually a right if you high blood pressure. And if you also doctors about lisinopril. Lisinopril no or your ACE inhibitor. In the chest or no enzyme we say no. That lisinopril no to me I a day as sonimu no man in year you must say the day is see here e wo honem biam enti e honem biam no say the enzyme no your system see a system enti you find so we feel wo plumbing system so wo plumbing system dey nsuo ni na mu wo fie no mu nyina e bi call bathroom e bi call toilet any idea your honem bia no so your different systems wo your cardiovascular system e ho na ye dey etumi bo ama wo koma dwumadi ese koso nyina ye dey ekoso na tubes ahodo e ye dey e wo sa cardiovascular system to say you fie no plumbing system tubes ahodo wo na bi call bathroom na bi call toilet any idea no into your bibi e wo your honem bia friend system Now, sir, your first system we renin angiotensin system. I didn't know if someone says I didn't ask if someone says I said who be into that. Yeah, before no. Yes, I are real wedding and man a bros. It is all of our fast or blood pressure yet echo from one. A while no not message a cop will kidney more conscience. Nipa the blood pressure call from to the blood pressure call from ama ensure so when them dream yet and so echo from now we live and also so information so I send the we live why can't tell live and say the echo so when them do answer blood pressure and call from names you so call from Nintino one okay someone said the cancer enzyme what them one sabrino my angiotensinogen my be if we say yes I be to about blood pressure and anything apostro into a while live and the man not kidney no so Aba ye be a friend of Renin. Into Renin, no now quack cancer angiotensinogen no. And why not sano? Now quack angiotensin 1. Unsa because we say enzyme F1 be a day ecoson tentem. So and your angiotensin 1 no pa. No no your friend is saying lungs. And so I realize that's how we blood pressure for me. Said this to be a baby. Now it to be a bois. Emma near my cost on tentem. And why now lungs so I'm a baby a friend of angiotensin converting enzyme. No free with lungs to my day. About the cancer angiotensin 1 no. And yes, I pass into a year you must have. And why now this angiotensin 1 no? I call for angiotensin 2. Who's a canena 1. It's answer with lungs no. And my angiotensin converting enzyme. And the angiotensin 1 up for carbon. For carbon part. Now say a papa angiotensin 2. And the acquire sata why it because angiotensin 2 ne or blood vessels. Most of the can say your cardiovascular system, your coma on your pipes are what tubes are what will go through. To say you will feel what tubes are what will go through a plumbing system. Into your final tubes now acquire you what said your baby between about blood pressure and anything. Asaba review. Then your when I say Asaba. Into Saudi way idea a so the Bia or wouldn't be and idea I find it so. And never cost or chin and cost. There be a jumedia air cost when the moon get be a rata. Now, angiotensin convert angiotensin 8 na make up what them no. Only you be dear pa and the say a bois said ye be a Emma with lungs and your day and say into only the jumedia so bronicas or preventing injury. So into or preventing injury into a body answer paying in emuno be all when them be a piano or bohon by said a bear and yet a yarium nem for saying. Now problem a woman say sa angiotensin 2 no say when you COVID-19 na COVID-19 to be a cold when them be more. Now quack cra angiotensin 2 no ace in America no a cook cranium now you're no hostage. They said their own so we take it or ya so maybe a America for hostages. And also people why are incarcerating no. Sabre pa kono ni no whole view. Ya seen that tomorrow so uni who view. It is sabre no. Sa ace enzyme ya make angiotensin ya make. Sabre no. So COVID ni ko mu pa na ko kura no. It is any hostage. Jumedia anka se edi wo hu nam bia no mu. Ene se anka airboa na wo lungs no ense airboa na inflammation ya dey enkoso wo hu nam bia mu. Airboa na wo pipes na wo hu nam bia mu ni en liquidation free mu mba no. Sabre no ekura sa angiotensin. Nti ekura ni mu no jumedia se die no na prevent problems no. Sabre in to me this adwumadi ni bio for the COVID na ekura ne mu denjen I am a hostage enti adwumadi ye no entumi enye den eni bio na de omo ahunu ene se ebibifo no yen sede ni angiotensin sa ace converting enzyme American ACE2 no yen sede ni bebre so ohun enti kanu no nkeye but problem a woman say se ko ba se COVID ni to me etwam ekọ hu na mbia mu a esan se ACE2 no ndoso nintino dwumadi anka edie no kakra na wo ho no na ye sa dwumadi no but sa brain no COVID-19 iden aba be fa no it is sabre we holding the hostage into ACE2 no to be nya dwuma sa de sitie into sabre no wo lungs na COVID-19 attack ho na say wo lungs sabre no wo heart na say no sabre wo GI system ya ka wo GI system wo yefunu mu wo intestines bi ade na say no fi so ma kunu se COVID-19 no je kwaya ni se wunya anya wo lungs nkwa na affect you affect wo hunam dua nyina broni fra bibi multi-system disease so and when they say wo hunam dua bia nti e be affect wo koma e be affect wo lungs About say we yefuno and no to be to go one as obofu no be nya no ube throw up ni ade won sa say we kunam bia no COVID betumi ayede affect hono say ya wan yen tentem am we nya e bia anko hospital am wo wan hwe wa anhwa e be cause de problem debris and no tin aye before no ye what's our problem ye ace2 no and said and into COVID ne ba ne be kura mu dia na chese ye huna mane na asema ye dey abaye na unsame to me anything say COVID-19 myth or truth na me pese me chire we ase ansa na for COVID-19 no by vaccines no so it sabre no your vaccines your Moderna for your omo de Pfizer and so for aye dey ayo omo de AstraZeneca so aye bi AstraZeneca for the they approve it Europe into Europeans use to say and as I say US for person we the omo approve it the person what here say some vaccines we me no I approve Pfizer and biotech for the no and they Moderna for the ni me no unse chroma see a draw usually we get clinical trials your clinical trials are hold on me and I was so young son FDA I dey am approval now what that research we and check so what we know just a short period of time because we are in a pandemic. And it's a pandemic new costume. So we are research no who said yeah juma pa now FDA for so we know almost share information now we ban no almost share the information papa no more approve but the person what say vaccine you approve it you probably emergency use authorization during a pandemic no say Arabia by Ariana Atisea FDA to be maybe a friend emergency use authorization. To be FDA for website so emergency use authorization and almost the amount for our vaccines. No we hear research almost vaccines no a 95% a year juma up to 95% and no to no we hear then or approve here then am I it is our Pfizer and it by biotech for vaccine a doses in Sana Moderna for no so the doses in say omo try a research as say omo betumi ama na ye na bia nka a dose ba ko pa but so far ne de a doses in nti pese mo tia say a doses in to be what first dose na second dose I think about probably maybe 6 weeks after no akọ second dose no meaning this question we will say and I say me coronavirus make me our vaccine. We make me our vaccine. There's all 90 days from the time I'll be diagnosed with COVID-19. Over 90 days. And son, why they walk up on you. Now, I didn't see crana. Also, maybe I want to say, you say vaccine the but just the safe freezer money home crony. But I didn't say yes, sir. Okay. In this technology of Bruni use your friend mRNA. Now, me go into detail with mRNA. Problem with mRNA and the same, a fragile, Bronica said be a fragile, any ahwarding. In case answer any ahwardino, so what would we worship ya? Now when freeze ya, a bebu, not a say. And no to do why and they say, what would this mRNA technology na asset lipid mu, a dear ben a lipid, who's a social in sure one when ya who's a bubbles be dream. And no ye in sure near and no ye are one. So and ki obodi ahye saa de no saa na a protect mRNA no na enkobubu ebra ekọ baby esekudru and enu ntin so na see freeze no nti obo freeze wie na bedru de bedru a na ye de ba be manfo for na o ma yi free freezer no na o ma store nti omo store na chese why den watwe de awo odipa nti ni nyina na so protect saa mRNA no enu nti na akọ basa nti I hope say no nti ase na ye adwuma. Inti mRNA no kra ye adwuma sen. Inti ye woniema ahodo ye honam dua mu ye fra bibi ye woniema ahodo wo ye woniema ahodo ye honam dua mu ye fra genetics. Genetics na adwuma ene se eno na ma wo ye snonko e chen bi. Inti ye wo DNA so ohu. Inti eno na be ma wo wasa wo papa ana wo maame ana obi o wo abusuam. Ana be ma wo ba ayeden asew so ohu no anya broni fra bibi characteristics. Etisawo DNA na adwuma no. So any what RNA so or no so eka saa DNA hu mo ye adwuma ye den e wo ye ho nam bi enti de broni aye ne say e te say wo sma wo bi unka me ka so mo de shell lipid mu e wo te say de Ghana anka nkrofo mo so anema no so ahu na wa bo kashiri no wadi kashiri esi ni ti so eto na pampem no wadi niema ye de esi so sa na mRNA ni tie because mRNA ni sa brain no e se lipidum na eko into lipid na ye se kashiri and mRNA na ye de akwa hye sa kashiri dum enfifi ho and e ko ho na bie no me be say me kasa de be ye chrome for mbete de me kana fi okay enti say ye de vaccine ni mawa ye de wowa de ekoba ne se ko ho na bie mu a na ansa na mekọ ho no mo ba me ncheche bibi mu yakopon hu se oboye no oba ye bibi e friend immune system your immune system and then the kutia yare nti ya fan se bacteria bi na virus bi ba wo mu a ehwa na immune system no asojafo na wo mu no aya kutia yare no oma mount bibi e friend immune response sabre no be kwatia sa microorganism no wa ba wo na bia mu fi so ma dwuma no it is one mount immune response and one microorganism na no why they or why release near maybe afodo ye would killer cells the whole crony ba no mu nyina ba no ba ba fast microorganism no ba re no ba spitting out every hunambium na afa hunambium nefo no bu ria ye free bibi memory cells no I hate to say your computer now what saving near my ayede ebu computer no so and our memory na our computer so and also we brain you pra also we brain no you store information with your brain if you hold bia your wadie 20 years who ni pakra no akai saade no because our memory no enko ye still that's our brain no e bia no wadwen you so race but who ni pakra ne fa na sa memory na ye den aba back sa ne hu nam die the immune system no dwumadi a ono nso odie no which is so amazing. And a bra microorganism be called hunem DM. Our no be no was saying on yeah. Na memory B cells no so no sabreno or more ayade. And the sa information ayade at na ho. It is a cobasta next time no some bacteria at the chrono and na sa virus no about hunem DM. Esan se hunem DM asoja for ne ehu sa de ne da no. No matter mount immune response. No, why don't to me ayede eku. And to the same thing, and over the ISR vaccine way. And to a bra, the one who panion about hunem diamono. Now hunem diana amount immune response. And to amount a soldier for no we are no more who idea when you're near anything. Interestingly, no, your hunem diani near ma a tear hunem diam all the time. Into your honoms, when you have say now, and you would not be any. Into your say, yes, say. Yes, we so swat. Ya sign am a memory cells no so swat a day. A crabby be a warm ho. Never next time you who view a day. Ya ko a day. And your compounds and the catch of the coronavirus no a year round as spikes be at the time horn. Some mokaya. Into your wall paniana. Bribe wall panamari no qua. As obos and not lipid na a day. I destroyed. Said they will be released mRNA no. Into hunem be release pa obo the spikes na e what virus ho no etutu so ho enti etutu sabre etutu said e be den e be attack your body na afai no but ain't me yes because e kwa na soja for ne say e see e ba na ebeku ti soja for ne ba no be mount response ni wia na memory B cells no so aye den e kura sa information for that enti sabre no when ya immunity over building immunity over time. To build the immunity now next time is the COVID-19 yawa. Will memory B cells that kai COVID-19 into embedding or be mounting immune response. Into ye be all be yare kakra, but when yare as much say be a will lungs as here do water vents so and I say be a GI system problem day aba honum. Into your no sa mRNA na ye can't was some sabre. Now a DNA so expected. Side effects of COVID-19 vaccine okra ebi anything. Side effects ebi ne se ehobeye wo ya. Ebi ebe hono kakra. But mo bi an kan hunu say pani ebi a obewo bia no. Emfa ho say ya vaccine o say ya vaccine o. Definitely ne san say edi bibi wo ho nam bia mu no. E say definitely hoye den. Eye wo ya. E say definitely ebi ehobeye kokko kakra. Definitely ehobeye ebe hono kakra. Ade efo fro enso so ne say ebi obenya fever kakra. Because can who say ye the BB about when them dream and yet I know that what they be are. So what I say, in Tabia when you fever kakra, but any serious. Abia will our bedo kakra, obey as a one bro, pile. But Sanya money within about 24 so Sanya money in a day, ebeko. But the investment we see Sudia and it says, so when him so you'll be what allergic reactions be brave. Also, be all cry or the saka grass or cry. Then the who you high side and a woo. So you'll be what allergic reactions be brave. But one thing, then the healthcare practitioner ain't doing como. So a year doctor, so a year nurse practitioner, now physician assistant too. No more doing como. Then more who said, yeah, of course, we say our allergic reactions. Then more about a foot too. And son were to sign a mono so for your day, walk walk COVID-19 vaccine. And therefore, France will be to me aboa and son of a penny and it's all benum you be brave. So who wouldn't a bois. Now saying so over dress it lightly. Say be that walk on or be making sure so one cent idea to 1 idea. So one over dress it lightly. Now what exercise one son also so and son away a day. Wako. So that's all for COVID-19 vaccine. Maybe a more monitor or more panel number one now. Maybe a 15 to 30 minutes or someone making sure say be when your allergic reaction here. I like to say anaphylaxis and no any say what the one now really why day as I see of no now won't be home now so we throw it in a close up. Say yes, what you want to see on the will be a friend epinephrine. Now why a day to be a protector and ankle for problem your day. But a papa will free one out coffee. Now, when you have allergic reaction, yeah, but the other friend 911. Now, right away, no, or mobile now, or making sure somebody taking care of you. If you're quite no more fast or more distributed for COVID-19 vaccine, almost started phase 1. Phase 1 almost started there last year. Until you go all the way into March and now say April. And normally find them healthcare practitioners. And almost we do more long-term care facilities to say be a nursing home. And they assisted living facilities, police for, fire for, emergency for. Your friend is saying, what with that prison? So one hour more shelter, almost so, and normally home health aides, any idea, no, and also so over young for what you bear the only kind I go through phase 1. Now phase 2 almost so many wine. Phase 2 young for if you are more comorbidities. 2 or more. In theory, our high blood pressure and diabetes will fall into phase 2 category. No, a teacher for and school. One more year, Juma, bus and train and idea. Grocery store for utility for young perform better to say, yeah, with electricity near idea. No, aha, one more. And for a year, Juma war agriculture. One more year, Juma will form near idea. Food workers and so. And now, we use sanitation, or fire trash, no public works of one crop for a year, you know, when the idea say, a quantity to 2 and I didn't war, and that's some abba. So the winter they didn't war, not a quantity to 2, not some abba. There was so the age one, or many public works of 4. And the public health workers, or many find them, or many for a bra COVID buying, or many contact tracing, no. If you ever say, when you're COVID, when a bit was okay, he found out what the last time. Some who for exposing COVID where the MR public health workers have been so community into almost so a young for and where this 65 and over phase 2 no and will be our comorbidity maybe back and so what's more come and that's phase 3 in a day a better later cry because phase 1 a copy bear March April. Phase 2 is starting free April hall conwa. Phase 3 they would a bear August on baby. And we are the general public. Into who you will be, I won't fall into phase 1 of one and now phase 2 for no. Now New York City, meaning Cuomo can say, starting this past Monday, no. No, almost be a COVID vaccine center to be brave. Said the Beya and Crawford phase 2 for no. Or between Amoko Wapaniano. Now, after so no one making sure that pharmacies also so ebenya vaccines be normal day or to me our more. Now problem or move facing with New York and they say appointments was they say a quiet day. Me say my try and then the whole day think let's schedule appointment mommy. At now phone so over 2 hours will be a day but call online so according the zip code I could ship I could so many places because be I would say no appointment. It is almost kind of say, tip if you be the Maya, New York Times, and a kind New York Times in it. Tip on the background the Maya and say, and I joke, if you are at your midnight and I have my channel, no more release appointment. And you have to keep on trying different ways. It's my imagine say, Nana Jean, say, I mean, where you may have a Nana Jean, no, check him alarm. If you are my sorry, there midnight. and around 1 a.m. I go to Menya appointment I day. I'm a mammy New York. Into New York, no, Javits Center, baby, or more mass. Your friend is saying COVID vaccine and your home Bronx to say baby or honorable. It's a Lincoln Hospital and North Bronx Hospital, Montefiore, Numuna, Manhattan, Queens, Brooklyn, Staten Island, a whole Westchester County, or baby brave, or NYC.gov, ube to me a police information in every one of them. No, I would zip code the same one. I know information that's how we are eligible because it's all answer questions. So we are eligible there. Or to me, I'll go ahead. No, my day. Our COVID vaccine. I mean, we are no mess was saying. So we are eligible. Now we need BBR, air prevent to someone call Paniana. For more Diana Kowa. Free so we share the choice between getting COVID-19 and dying. And now the after effects of COVID-19, such as long-term respiratory problems. Madame could be nearby. No, Vera. Me asthma 20 years ago, and I know asthma. Me asthma nembada, and so me COVID the coin. Sabre me asthma, or say na jubi our da on to me who me a year, or that say on to me who me just or the insumia bebre, eto no to be that's no opportunity, but no crano a problem. Intimidianum, weigh your options. COVID-19 and all the after effects of COVID-19, such as wakoma. Such as with lungs, such as with GI system, such as with then the COVID-19 vaccine that can also prevent some of these problems from happening. Weigh your options and make a decision based on information and media. Unfortunately, to be involved, me and Drew me so crashing our vaccine because phase 3 4 because me interacting with patients. Me and nurse and so me interacting with patients. Me a Juma pharmaceutical company. And to me, Juma me and say me educate physicians, nurse practitioners, and physician assistants on yen run day. Yeah. Into me virtually. So me doctor be crowd officer. Me yede me nchewo. Into me need that phase 1 phase 2 no because me who patients. I idea doctor for the nurse for the idea that me no interacting. But I virtually. Your computer so and no may fall within that category. Sen can fall within that category there and come to America de akọ panelo. Meaning some problem ba form so munya ne nurse for be brace so munya den wo mo panelo. 30% of nurses say wo mo panelo. And so almost no who patients all the time. If you quite any ever fast you may encourage you almost. And that good one also ye day a year before. Yes, we before na yare day e queen. If we some crophobia in our gene say Pania no be what year before no more queen. Million and no correct. My research for a long time. So I say it's 1, 2, 3 clinical trials here and the oncology nurse. Now me involved in it. And yeah, or mobile vaccines somebody be cool. Dr. Fauci or what Pania be. So Obewa and Dr. Fauci were with that. The man is 80 years old. Obewa and Fauci and Obewa and Biden and and Kamala Harris, because will be. As a matter of fact, interesting. Marco Rubio cry, no what kind of nonsense to say. Your friend is saying, one share mask, no. Why jump ahead of the line? I got COVID-19 vaccine. I mean, fair to say, and I also want share mask now for the vaccine. It's so, but all we now go, saying, you be your one and hear who the data. Intimidiano, the MS when they say. So we fall within phase 1, phase 2 no more. That's all no doctor di hu come na your case or be wo panena to one am na ko wo panena. They save you because you want to live. O person wo tena say be ya wo ma no na no. That you be hu o say yesu nye den e ma ya. Enya ade a o ma ye so mo di be kun ya minuanum. Enyo de o person mo kuma be before. O person mo kun ya ko ma kun ya dada. And I win sa. Yeah, where your neighborhood say I mean they can do anything if they want to. Very simple. Inti omo COVID-19 so many be queen. I said a bit to be a save so. And at the same time, keep in mind that our goal is to vaccinating at least 80% of the population. So almost to be vaccinating 80% of the population, then our lives can go back to normal. You bet me sorry. Say you to be sorry because of COVID-19. But almost to be vaccinated 80%, and you be a friend herd immunity. A protected import 20% normal one. You bet me they are protected warm. That is here to me I get it to your regular normal activities such as camp meetings. They say to be go camp meeting until such a time I said obi are vaccinated. Now, another way to get herd immunity, and they say, anka 60 to 80% of population they infected with COVID-19. Now, we're going to want into 60 to 80% of America COVID-19. And how do we know that 60 to 80% it be a woo? Don't want to be a day, it be until fast will be a day ever. But the vaccine is a way to prevent a lot of these things. Into Mr. Ramo, you need to make sure that you live instead of die or get the after effects of COVID-19. It's Kuffour-Manu and Kuffour-Manu questions.
Yo, Sister Vera, yeah, that was it. Very therefore, so church as him we amaya. Na me say nipa bebe was in bisa, and it knows I've been a bema ho kwan. Obi was in bisa na sem bo bia, obetim dia ba na fi no. Mami o he wa traso ana we ya no amaya na fi yate nsemina ina ase. Madam ase. Okay, Brebu Shafo, I don't know, Ebano. Sister Vera, maybe so a same way. Eddie Kana, what can be business a better walk as a sawisha and Talibia a light and patch of reason say.
Yo, ain't it someone person, yeah, right? Side effects, you be pain and it's swelling, any idea. Now, when walk out was set at idea, Taro when I'm one. Yeah, well, penny really we are. Who's atade ne be say den atare wo honam biu enti se hoye wo ya ne ya ne be den e beto aso fa so on enti e better so be se bibi e light ne nko mia ba bia ye den ye wo pane no eno enti ne ma me ka sa bibi e light e betumi ahome e breathe through
but at this winter time so sir that ye wo
oh yeah, so winter time mini abe ma see ye wo entade a long sleeve but ye wo ne ma a light so then cast a sweater be crowd or was shy and meow. We say, we don't send near a carry or mohonum. That's what I'm talking about. So you want to prevent that. It is over to me. Men should be a better children who I'm saying, one more penny and there's a near swan son, why they I could see.
Yo, Sister Madam.
Doctor, was na my same bisa ASA. Okase mun okase be say 30% nurses say won enwo panel no.
Yeah.
So if say a nurses yet 100 people, male and female. Na emu aduasa esi won wa. Me just say big number.
I agree.
Na before we no crown na I think so Europe a doctor's been so a dispute facts ebia moma e sa COVID-19 I just say a dangerous. What me excited back to 2015 Bill Gates a year sa COVID-19 na e be my crash na with me apple pound say bibi eba when na ABC a just a theory bia however me say anami who said first African and black be here no China one dey no call hospital no na the immune system is strong say a microphone one say MB it is supposedly I to say at the end 1 year Africa for yes I can be now me say theories among for the to her and nunti once I think Netherlands 7,000 nurses one more panel. Over US house, name how many nurses America get, but 30% so quite substantial. It didn't say yet me and pushing under the rock so and yes she and she share 30% in one reason, anyone take one and I say, this is an only a give say at the end. Now, so I say, one the end of the more mammoth, Namunti way. Now, it'll be a skeptical to say me no. Me, how I to say, Yashi Monko no. Now, Womra nipa 30% there, won't make us say, and Yashi. And Adena.
Yeah.
You get in a bit me, then you bet me a year. Not yet me a disprove.
Okay.
30% no.
Okay.
So one theory now, but the doctor say, what Europe I'll say, and yet at the end, you know, you're the bit. And I guess you say man-made, whatever, a virus, man-made, no, Korea, a bacterias. I don't know, that was
okay. Okay, to be specific, the answer was second question. Remember first question. Say a man-made, it is not true. Into once again, we all can be theories, right? A lot of these are conspiracy theories. Everything you do, you need to back it up with data. There's something called evidence-based research. And Sana, Chrome has said, in for overture article, okay, me have a dissertation. I couldn't just write a dissertation based on OB opinion. Said this person said this. Now, said the Trump dissertation, me have a literature review, no, and was said the cover articles on Kuffour-Manu. So research will be approve say or research, say no free more. And then means to yes, our research now. This is what I get from it. It's doesn't require literature review. And the literature review has to be a current literature review, meaning say be within the last 5 years, not anything before that. And I'm a literature review. So my literature review was about what, 30 pages? Because I had to dissect everything people had said and compare and contrast to what other people had said. It's a evidence-based research, okay? And for a very long time in the entire world, not only in Europe and the United States, in the entire world, there are people who are against vaccination. It has been there for measles, for mumps, for rubella, for flu vaccine. You want to actually say, your friend is saying, what's our vaccine? We are, autism, and the home and it is not proven. And what we saw, and this is some time ago, I think 2 or 3 years ago, California, parents, and these are highly educated parents. These are not parents that want to poverty. One want vaccinated woman. Now you say measles outbreak be by because parents bako eba enya measles. One vaccinated akwadano. Emma akwadano de ye enkwala bebre. E cause a problem. Because ojina so say or what the banner you obenya autism. And it's not proven. There's no data to support it. Obina tewa walker. But research on these autism children to see, say, what happened in Kolenia autism. It is that I just want to dispel that. It's a lot of theories, and there's no founded to support that. If they have data to back it up, they can give us the data. If they have information to back it up, they should do that. But you can't just throw out things without having anything to back it up. I said Trump will kasa, nobody be to back it up. Trump would say the election was stolen from him. Okay, fine. So give us evidence to show the election was stolen from you. It wasn't. You know what? The truth is you lost. So go sit somewhere and let's keep on moving. So at the end of the day, making sure so we have evidence to back up everything. And if we do have that evidence, then people can start looking at that particular evidence to make sure that you're wrong and you're right. Once again, coronavirus has been around for years because it causes other illnesses. It causes other illness. This new strain was found in 2019 because a nipa aswande. All right. So nipa aswande na man basa and webi wo ho nyankopon kai se ba ye re emwa no. I mean, it's clear and it's in the Bible. I'm not making these things up. In Leviticus, it tells us what to eat and what not to eat. But these people in China decided so someone almost strain of COVID, a coronavirus, they ate it, transferred into, and then what happens? They started giving it to other human beings. It's unfit. So that is the cause of this whole problem. Coronavirus can live in animals and not cause harm. But that particular strain, when you eat that animal and you get it, it can cause you harm. God has told us not to. There's a certain microorganism in a pig. So these are some of the things we need to understand from a medical standpoint and from a scientific standpoint as well. As a walk about 30% of nurses almost will vaccine. And I can tell you, so most of these nurses are black nurses. I didn't know more casa because if you go back to Tuskegee, when they did the Tuskegee trials for syphilis, or bankrupt for syphilis, okay, and then they went back to treat them. Sabreno, now you need any rules. Now we have clinical trials. They didn't have any rules on paper. Say we have clinical trials. Say we sign consent. It's not say now we we didn't have that. So after Tuskegee, they put measures in place. The same catcher would say, unfortunately, COVID-19 vaccine trials, only 9% of the population were black. Only 9% of the population were black. It is therefore say what would you probably not 9% say before. Not the entire United States, the black population is about 14%. Not only 9% of us decided to participate in these trials. We've done ourselves an injustice. And why do I say that? We've done ourselves an injustice because how do we know, say, this may work effectively or not? You have a lot more white people, Asians, and then 9% of us. Because of all these theories and what I've been doing this in my community, educating people, educating them, explaining what the vaccine is. So you are not getting a live coronavirus. I want to explain that. It's not a live. When you are a live, who's a vaccine is a live and you are attenuated. And yes, virus waiting. You're just getting the mRNA, COVID, and they're called Hunamu. And your life is called Hunamu. No, that's not what it is at all. I want to explain that, make that plain. So they be a bit careful. It is 30% of nurses obviously more. We need to educate them. We need to explain the mRNA technology to our nurses, right? And then we need to bring these nurses back to say, okay, some are vaccinating against diseases. So why do you vaccinate your children against diseases? Whereas you don't want to get vaccinated. We'll vaccinate you, but the argument you make is say, oh, me protect him. So if you're protecting your child and you want your child to live, why don't you want to live to see your child grow up? We need to find ways to explain it to them. They are nurses. They have the education. They understand vaccines. And they've administered vaccines to so many children. And not only children, adults. They administer the influenza vaccine to adults all the time. Okay, so if they've been telling us to do it there, what is their problem now? So we need to go back to what they've done and how it's been effective over the years, and then bring it in that direction, and also show them evidence. Sometimes the people need to see the evidence. So show them, so when they did the clinical trial, this is what happened, this is what happened. Because I have to tell you, the clinical trials take a long time. It takes a long time. For a drug to come on the market, it may take 10 to 20 years. And sometimes the FDA may not even approve that drug. That means the pharmaceutical company will waste this without getting anything out of it. Vaccine, we are in a pandemic. And whenever we are in a pandemic, the government can actually use that emergency use authorization to do what? To approve a clinical trial if they've seen efficacious, if they've seen it actually does work. And if it does, then they will do what? Approve it. And education, you've got to educate the community, and especially our Black community. We have to educate them and make them feel comfortable.
Over your question.
Okay.
Sure. All right. My question is that what can one say And sana vaccine be out, it take a very long time. I think I say in case say your pandemic, the government bet me, I'm an about. Now ebasana, how safe is it? Say I'm taking normal period and due process na sana I about na bibinti yamana about in terms of am I safe? That is my first question. My second question is so be taking vaccine na obet me spreading out and what taking vaccine all right. Obet me spread the virus no around.
Okay. All right. Into your first question. We'll say, Mekachara will say, yes, of course, it takes a long time for a drawback to come out to the market. It can take about 10 to 20 years, sometimes 10 to 15, depending on what you're doing. The interest in a pandemic, or allow might be ever out, and they say, a problem, yes, our clinical trials, results now on Winya, not excessive vaccine, it's 95% effective. Senka vaccine, yet that any high efficacious value now. And FDA in oh, right away one year. Because I have to tell you, even influenza vaccines, the cry one. And do 95% efficacy. And do it be a 70%. As you see your influenza vaccine, right? We don't even think about it. We don't even blink. You could do as flu season, boom, oh, and so when you flu vaccine, no it's influenza vaccine, no cry, who research for a long time, no. 95% efficacy na that's there. Still get the vaccine. And no into the bro who said it is efficacious up to over 50%, no. And no into the prove it think every for the coin who say and yet efficacious and 50% or lesser. And emergency use authorization. Again, no, it is for emergency use authorization. And no until I want to enforce it will be also on what vaccine, because it's emergency use authorization. It has not been approved by the Food and Drug Administration. The FDA forbearance said they will go back into after people have been vaccinated. They're going to send them data again. They're going to review it. And if you feel sufficient, then it will finally be approved and be a vaccine so you can get it all the time. And also in China, as well. And not limited in quantity as well. Well, second question here, dear Nipacho. You asked the second question. I think I
so we taking vaccine, no bet me spreading out still now.
Okay, into cancer, okay, we'll be taking vaccine, no bet me spreading. Into the main shot, I can't say. So when you're COVID-19, that's all you're infected with COVID-19. And also will take 90 days from the day you tested positive to get the vaccine. Now, keep in mind, this is a new strain of COVID-19, which is B117. So we don't know. Once again, there are lots of things about COVID-19 we are learning over time. Your friend is saying, what? And also when senior idea maybe be good so but they say who said even if the droplets they stay a day so when you be over COVID-19 it's not a day back for more than 15 minutes within a 24-hour period we are more likely so be COVID-19 which is something that we didn't know in the past. So we are learning a lot. So just to let you know, you can get the vaccine and maybe a day when you have vaccine maybe now we are positive for COVID. You probably didn't know. And if it's branded yet, we don't know. You may be able to spread it because you probably didn't know if you're asymptomatic. And your brow call vaccine no testing for COVID-19. Just to let you know, what would say they're administering the vaccine. And you don't have to show any proof that you were negative for COVID-19. And so for those who are asymptomatic and are carrying the virus around, you probably may spread it. Because the day that you get the vaccine, it doesn't mean that that's the very day that you're going to mount this immune response and then the memory cells are going to know. It takes a little bit of time until you may or may not spread it. So once again, if you're positive, then that's a problem. Until vaccine, it would behoove you to go get a COVID test done, but do the auto antibody test, which is the blood draw. And when they are one of the best tests that are out there before you get vaccinated.
Yeah,
Let me make a small contribution.
Okay.
Yeah, with regards to the vaccine processing and time, I think recently there was a 60 minute the production there. Or talk about that. And they explained there, under normal circumstances, the level of technology or what the vaccines or a longer process. But fortunately for them, due to research and improved technology, this particular one, they were able to map out the genetic code very early. And so with that, that's what helped them accelerate the production of those vaccines and as against the previous one. Previous one, where you culture what the X and culture, but this one they didn't go through that one, and so with the improved digital technology, they were able to move faster than previously. Now, secondly, because
they have already done. Okay.
Yeah, to the fact that the same people now, the conspiracy theorists now, then women who there for the longest, them Kennedy, Bobby Kennedy Jr., they're the same names now. Every vaccine they have, they will find some stories to talk about it. They are against vaccines, and the stories associated with any vaccine, any new vaccine, they just pull some new story to fit whatever they want to know. And maybe they may have some point, but I don't think we should subject ourselves to the fear mongering will put across and most contribution.
Yeah, that's super brave because, as I said before, there are conspiracy theories about vaccines, and it's been there for a long time. Me catch up with vaccine, autism, which is not proven anywhere. And almost spread this idea in the background every day. And we just need to be careful. You need evidence to back up everything you say. So only evidence, then you cannot really prove what you're saying. And making sure the information is there. Technology, as of any kind, it's been there for a long time. And they already mapped the DNA. They've done DNA sequencing for a long time. The Human Genome Project has already been done. So they already know what these things can do. And once again, just to let you know, in a pandemic, if you do research and the results are good, yes, they're going to jump on it and say, let's give you emergency use authorization for now. And then later on, we can come back and also look at the aftermath of the and see and then give you final approval.
Okay, Pacho, Mr. Mewa question, Kaka. The vaccine be preventing from getting the virus. As you know, Sibia, menene juma, what vaccine tuning na. As you say, when your virus now tiffy.
Okay, that's a very good question. Once again, let's go back to this. Obi Wafa, no, you're symptomatic. And one mistake people are making is also said the more you were tested, you're tested with who say when you're COVID. So, but you can't do that. So in these hospitals, maybe you're testing every week. That doesn't give you any good, solid information because the virus takes a while. Right, there's a 14-day incubation period. Even though virus because maybe the immune system is, working such a way that those people are fine. They're working around every day and every night. And she probably maybe had been exposed to someone with the virus without knowing, and she probably had it in her system before she got the vaccine. And once again, mommy and Chia said the fact is saying if a chronic ABN why you're exposed and now we're COVID and son war paniano. Does not mean so war paniano. It takes COVID away. What influenza vaccine? It doesn't take the influenza away. right? You have to be exposed to the flu. And when you're exposed to the flu, it can mount up as a response. But keep in mind, it says, not or at the end of that. And there have or vaccine, it's not going to help. Because the person has already contracted it. Because you need to wait 90 days after you get the coronavirus to be vaccinated. And so we need to also ask some questions. It's an American son, I'll be what vaccine, maybe a mema futu, I may be the same. COVID-19 test, which is the auto antibodies, not just the swappy with pneumonia, that is the best test. Go get that test done. Probably takes about 2 or 3 days to get the results before you go ahead and get the vaccine.
But let me start a question. The question is now this colored and I say for the Spanish for me more or more body creating more opening say of infected chain Europeans and Americans and also abroad for now. Now, I know that actually my drink a crash as Africa no. We share a cry or more quiet time share mass and manema. And no more exposed more to each other. And so yeah, I'm not really dynamic to say war I will form a chain. Europe and Americans near the Adena. I'm not actually my drink.
But that's the broken is what was a question. And meaning said we will be beside our question. And now Mr. Busani for corner questions. Ghana, how much testing? How many people are we testing? So come in Krasia, Mampoa. Nipa saying they are testing you for COVID-19. Testing site saying that one Mampoa, testing for COVID-19. And to be a short and crop be infected, but we don't know. If you see asymptomatic, and so you need so obi and so where because I'm yarin no yet. Why the testing if who yari ekuno? Why the autopsy ehunu ye? America says will be who hospital ye be autopsy. Ye be who do ekuno. Europe the same thing. Ye Ghana hopa ye healthcare system no. And ye so your healthcare system is broken. I mean no credit one work. Our healthcare system is broken. And you're broken so much so say we don't do all of these things that they're doing here in the Western world. Senkia Setia's testing sites. Ewa Mampong. Ewa Edujain. Ewa Nsuta. Ewa Angwana. Ewa Nkase. Ekwano Sunyani setting up testing sites. They are sure that the numbers would be way higher than what we think it is. If we were to do autopsies to see what killed people, the numbers would be way higher. But we don't do all of these things. So therefore, no, you can't really say, you can't say, the rates are low. And what you're taking this for granted, no. The mask, they don't believe in science. And then they believe in magic. Say the magic, so the mask they say, you know, magicians, no. And they don't believe in science. So the mask you do believe in science, you don't believe in magic. And we probably have to educate the people in our country to let them know that it's extremely important. So you need to protect yourself. You have to. And see, that's what I can tell you. We're not doing testing. See, it's not playing one back room. I say, "I tested one." And that's what if we have Ghana, we do one tested for COVID. They're doing that rapid test. And only rapid test. But you can who's the city for where you're exposed to will be our COVID will play in. So now when or do Ghana when I was testing the person is going to be negative. Because you have that 14-day incubation period. So the person is going to be negative until after the fact. When you be pass idea way and say it that ain't to me and make sense. Meaning so Africa there, yeah, because the COVID-19 by is a and I'm a boy. Very who roams so by. You know, yeah. At the end of the day, we're not testing. Our medical system is broken. It's broken.
Okay.
But your follow-up question, yeah.
Yo, brother.
And Mama, when you pacho, I'm Brazil.
For them, be last.
I'm Brazil. I will point to making no. Me you convinced, Papa. Me reason ye. So, facha me. Me share Africa on the death rate, no, as compared
to.
Okay,
we'll break it up.
Me pacho me clear. Then I make can say response at men. Me you convinced, Papa. Me point in ye, and I'm a reason ye. Me share in terms of death rates in the US and Europe compared to Africa. On the Africa, death rate no from compared to US no. It no 8 million basis in Kasese land, we are able to resist a body resist say arena na.
It was a death rate no from internet and no say your friends say yeah you to be resist na.
A layman point of view na me free ba.
No. I'm just asking you the question, just making sure so I can answer it correctly. What's say your death rate no from? And you are not just your body to resist the COVID-19 Is that the question?
And yes, exactly. But based on answer now the man you busa question 19 ma make asa. So on so in Africa na there were virus and I rent ekuen no. Enya more than say aha. And you come the me to ho a send be see aka fa o me in that way.
Yo, okay. And you pass say aha no e kum nipa more, aye nipa more chain Africa. Okay.
Aye.
Okay, and so let me just put this in perspective for you. America, you're from the United States of America, right? It's several countries and boom to make these 50 states. Ghana, you're probably the size, I'm not sure if the size of Texas or Oregon or something, I'm not sure, but Ghana is a very small country. Nigeria, so. But then you look at all of the African countries. We'll call we in our America, you crow a cassia. Depend what honey a day, a dorsal. And you, of course, no, numbers the day, ever wash because what if I breathe? Ghana, and if I say Ghana compared to the entire United States of America. And you, of course, your death rates, no, and there were from than the death rates in the United States of America. Because if I also have 10 your bed also Ghana. It won't mean compare those death rates. Won't mean compare infection rates. You always have to compare apples to apples or oranges to oranges. It has to be on the same debate, same playing field. It is and yes, you can't compare it. Yeah, of course, our numbers may be low, but once again, what can be said? How do we know if COVID killed Mampong? How do we know if COVID killed another family member in Minnesota? We don't know. Because on who crash no. Yes, nobody has checked. I say TB kumobi. So I didn't work. Say why get the test you need to do. And in Mobi emphasizing saying first of all, no, and so compare apples to apples, oranges to oranges. Depending also had a dorsal. And to be yet Chrome has say when America gets coughs, other people get a cold or the flu. Into your dorsal, and then you pass free baby day, ever chrome ha. You pass free baby day, ever has into all but the area day, ever. Into the numbers keep on going up and up and up. Yes, so our numbers are not going to be as inflated, but I can guarantee you, say, if we will set up testing centers in every village or town in Ghana and start testing people, we will be overwhelmed. We will be shocked at the numbers that we are getting. I hope that makes sense.
But you're making sense.
Yeah.
To add to that, if Africa countries are all very good health system now, a delivery system, and one world called much higher rate in South Africa, North African countries now. In Ghana, in fact, there are reports about 2 or 3 days ago, the head of the Ghana Medical Association will issue statements to the effect that in Zama will get out of hand. until we may even need a total lockdown. Then a few hours later, I don't know whether he was threatened or that he came trying to explain what he said about the lockdown. And the indications there, if I reported it, it could 37 military hospital, teacher was stop emergency services. Equal ward now, then go put the bench from possible corona. But they are not reporting them as such. And those figures in the dispute. And we shouldn't take comfort in the fact that Ghana is hot now because these viruses, as time goes on, will mutate and they can take up different characters. Flu in 1918, it started in cold climates. But as the men and all those things took it to the warm climate, and then it mutated and took different forms. All affecting us. We shouldn't take comfort in the fact that they are Ghana reporting. In Ghana at the moment, but they are reported. In fact, there 3 weeks ago, my cousin we purportedly out of asthma. Okay. Also, this time, asthma or severe, but nobody is linking it to COVID. It might likely be COVID, but nobody is linking it to it. We shouldn't take comfort in the fact that we haven't seen higher figures in Ghana. No contribution.
But that's the brace up and you can't because say yes, sir. Not we are actually putting ourselves like a disadvantage. See, yes, I say a cattle, you know what? I deal with you chrome near idea. Who could draw a crowd who protect you? So, because when him so, I really a new chrome into me at the member of the whole pine. But 3 of the American on the say, Yaria with a kumnipa. Yaria with a kumnipan 10 chain HIV/AIDS. A yawa, you can die within days or within a 24-hour period, you can die. Into me, someone, me, what dear, that kind of thing. Protect yourself. Wash your hands. Wear your mask. Practice social distancing. That's 6 feet apart, is extremely important. Mama, I am prayer. Who see a qua sorry them say, "Oh, Yankupon or baby, I mean, you said you fair pentama sorry. Oh, Yankupon or baby, Miss Rebel." Let us understand God is everywhere. He's omnipresent. God is omnipresent. Even if you go into the depths of the earth, God is still there. Let us now rush to go into the sanctuary. Because that does not show, say, maybe we feel so rush to sanctuary. It shows that we bring on the amount of you are not utilizing it. Because and he expects you to use that knowledge and wisdom that he's granted to you to make the right choices. God wants you to live. He doesn't want you to die. That is not God's purpose at all. And to be caution, wash your hands, wear your mask, practice social distancing. And who here, the first thing, wash your hands. The first thing, wash your hands. Go take a shower. And I will say, so when you washing machine, when we see, I wouldn't say house, when only washing machine. Put those clothes in a plastic bag. Tie it up. When pub one and wear gloves. For Clorox wipes, pub one because some who say even our shoes can carry it into our homes. Mommy be because of that. Wipe your shoes. Put them somewhere. Go take a shower. Protect yourself. If you can get the vaccine, go get it. But discuss it with a healthcare practitioner. Prevention is better. You want to live for your children. I want to live for my child. I have one. I'm sure say you also want to live for your family. So let us choose life instead of death. Madam Wasibe Bree.
Auntie, can I please ask a question?
Yes, please. Okay.
If you have the coronavirus and you have the antibodies still inside you, and it's been more than 3 months, but you still have the antibodies and you want to get the vaccine and you get it, will it still be effective?
So that's a very great question. That you said you still have the antibodies And so if you get the vaccine, will it still be effective? So that's one thing we don't know yet. What we know is that you can get the vaccine 90 days after you are infected with COVID-19. But if the antibodies are still there, no, we're not sure. That's why Dr. Fauci is encouraging people who still have the antibodies to donate their blood so they can use it for research. So for that, I would say that person should have a discussion with your healthcare practitioner and see if they can if that person will still be a good candidate for the COVID-19 vaccine.
Thank you.
You're welcome.
So do some for betum ebisa oboboy.
Who's up and your mom and temo into the who's up and your mom question.
On the lighter side, Mama said prevention is better than cure. It's from illiteracy, so you be on maybe our account today. Prevention is better than cures. What you are no market, provision is better than cures.
The provision is better than cures. But why better to obey provision? So the study the countries there, they change the obey cures are reading. I agree. Yeah, I totally agree.
Okay, but I'm going to this question. I'm going to this question again. But the new strain now Asaban.
B117 no.
And a mutation of the virus, first virus, and as a senescence.
Yeah. A mutation of a mutation.
Sound. Is there a way to mutating who just said to get to a time mutation be stronger at the end to me no.
And I agree what you're saying. When if the entire virus or mutating, a human behavior, right? We've been told to wear masks. You can't say and practice social distancing. But to Washa, and I don't want to keep on bringing Trump's name because I don't like mentioning his name. But to Washa, number 45, the rallies now, you know, nipa say the share mask. No, but you know, so see so. Some for almost spread the virus, almost spreading the power. So we are rally na sa nipa ko snap plane or ko that hotel or ko fa bus or ko fa train. No, the man for. One share the see what your friends a capital on the 6th. She nipa be brave or boy obi any ho share mask. And at the end so were inside. But then what we saw we just droplets be crowd or answer or move free ho. Sa kwai or the night ko see na the policy desk issue. I will say we on a laptop. So but then what your what now your friends say chamber ho no man wo tik akonya no so no. Sorry you said the horns been a city so crack 6 foot here. Then you will do the go. Akwe or yes and ninja no we could attire wall no walk from or move beside what I or the idea for more viewers. What the idea for more viewers chamber how the day call so the idea for more viewers. So we don't need so all these people are spread a human behavior, a bad human behavior. If only we would listen up, they are sure said and virus and can contain. But he ain't yet. Yes, he ain't mask. What's a mask a weakness? So yes, he ain't hurry and sack. The public one now from on sack. Oh, we are nasty. And to yay, dear Yakuno no crane, Mr. Mummy on hurry and sack. Mummy say a mask. Mummy and keep it 6 feet away from each other. And man crop mouth here so. Because if I crow up, keep this in mind. Everyone is positive for coronavirus, for COVID-19, unless proven otherwise, unless tested to know so you're negative. Put that in your mind. Everyone is positive for COVID-19, unless what tested when you're positive. And if you don't let people be coming to your home, oh, and yes, she ready so on one call, baby. Me COVID-19 by no. Obi ama me fie, me we kunu kwa na tia na yeba. Yeba no oba no abesa no woko. And so no kra wonim. Oba opese a test for COVID-19 and san wa be fie. Okon so oba me a test for COVID-19. Let us be careful. But if you say crofo so so bo kwa yi ene ho kro ne ba. Ni na ejina mo so. Yi wo kwa an hwa wo tin practice social distancing. Ube hu obi o ejina wo chen wedi nkomo. Kwako bonsa, and the home croneba. Because the table had also here because we to be get feet. So sign idea. I brought it back on here. And ye, Minianum, Mumia Fanny baby saying to him, protect yourself. You want to live, you don't want to die.
If I join another question,
you don't want to die.
Another question, Mr.
Well, last I don't know.
The question is say, vaccine ba out. On the time na virus na eba pana, say ye vaccine towards the virus na eba. Nti ebi omo use virus dey can appear no. And the based on that the vaccine. But mutation be matter say the vaccine can contain the mutation and the new strain. Is that possible? Because vaccine based on first virus na appear and how can that vaccine no contain mutation?
So it say almost can say it may be until once again no so almost can say almost maybe or man can say definitely so who fight against that. Until maybe we don't know. Until once again there's a lot of unknowns. Until we need to wait and see later on. If I say a quick example, you will be a friend HPV vaccine, human papillomavirus vaccine. Okay, a preventive cervical cancer. A preventive oropharyngeal cancer. Cancer which we are your minimum with throat ornament. It will be prevented. It will prevent war. Human papillomavirus, you have over 150 strains and the war. One year vaccine in 2006, one year vaccine to only fight HPV. It causes 70% of cervical cancers and also oropharyngeal cancers. There are so many strains of HPV. The vaccine may not cover all of them, but they are causing major problems. Why your whole vaccine to fight against it? So I'm saying that so that I can bring it back to the COVID-19. Yes, there's a new strain, but it's still coronavirus. Okay, so therefore this technology may be helpful in terms of fighting that new strain. But once again, we don't know. We need to continue to vaccinate people and do a post-marketing clinical trial. After vaccinating 80% of the population, do that post-marketing clinical trial and see if there's any if you're being a fast strain now, vaccine needs to be presented. So once again, we've got to go back and do that work to get the right information. I hope so it makes sense.
Yeah, that was mama. I mean, sure, Sabedi, a beja hammer now wrapping up, nothing wish I know. That's maybe a baby. That was
no. And to say COVID, the entire friend of COVID, a coronavirus, right? The CO stands for corona, DI stands for virus, and a D stands for disease. A 19 because we discovered in 2019. You've heard of coronavirus because we have virus now a round. Now it was spoke so or hine check sign it here. Or hine set chat. Tell me around so near my day home. Vaccine. I just want to let you know it's a vaccine and you're fully approved by the FDA and you're for emergency use authorization because in a pandemic, you can actually have emergency use authorization for drugs and also vaccines. Or we use mRNA technology, mRNA technology has been there for a long time because the human genome has been mapped for a very long time. So they try to use the technology for different things. If you don't use it for vaccine, if you mRNA of your friends at COVID, any idea set lipid because they are very fragile. Yes, they do. Now mounted response, immune response. So just one about the quetia. Now memory B cells. Now they hold this information. So they may adapt to who encounter COVID-19. Which we are quiet. It's your vaccines are hold 1 million. I approve you America. Moderna for and the Pfizer for AstraZeneca for approve you Europe. Sabri. Vaccine doses here they bombarding says for first dose, bombarding so be work second dose. And yeah, the other first dose, like they've been the same for side effects they be any say hobeya ya a hobe swelling a hobeya koko if you been fever obenya chills near the headache but they should go away within 48 hours into your idea beko. Another thing, the allergic reaction, anaphylaxis, bonifren anaphylaxis, and this thing can throw to be the as well. Into a wall panel, watch now for at least 15 to 30 minutes, normal observe it. So when you anaphylaxis, one will be the wall epinephrine to reverse that process. Sebastian Kobana could drew you know kunya, but what the other friend 911, but be your home friend 911. Now when you're the won't be the care you need. Meaning said there are so many conspiracy theories regarding these vaccines. The American say COVID-19 is a deadly disease. It can kill you. So you need to choose life. Don't choose death. But what the animal doctor and I say nurse practitioner now physician assistant in your discussion, discuss all of this. So we are a good candidate for the vaccine, then go ahead and get the vaccine. Choose life. Don't choose death. God doesn't want you to die. Wash your hands, put your mask on. Don't put your mask here. Because if you do that, that means that you don't believe in science. Don't put your mask in. If you do that, that means you believe in magic. And you don't want to believe in magic. Choose life.